I think the NHS is changing in a very major way. The new NHS is about innovation. It's about looking at new cost-effective ways, safe ways to provide the kinds of healthcare that people say they want. And we needed to look today at what it is that complementary medics of one kind or another need to know to make their way in the system.
Complementary and alternative medicine can treat a wide variety of conditions which aren't necessarily met in the NHS biomedical science provision. So it's important for complementary therapies to be in there for two reasons. Firstly, to help the patients, and secondly, so that we can gain recognition and undergo research, fair research to see if these things actually do work or whether it's just placebo. And if it is placebo, what is placebo and how come complementary medicines are so good at using it? I came to this conference to try and find out how I can take my proposal and my concept forward and make it into a reality.
My job is to manage a budget of £1.5 million a year, which we give in terms of development grants to organisations that work to improve health and healthcare, and we work alongside them to learn what works and make sure that we disseminate that to other people. I'm really interested in listening to what people are doing and understanding their world and how it's going for them, but I'm also really keen to get across a really clear message that I'm here individually and my organisation is here individually to help support, sometimes financially, that process of learning about how to provide better services for improving health by the provision of complementary therapy.
Conferences are always very useful because they allow a good networking opportunity. They also clarify new changes which have been happening within the NHS, and in particular practice-based commissioning, which is very quickly coming on board and will actually have potential opportunities and potential threats for complementary practitioners. So it's to learn more, to network and to look for potential opportunities for not only our students but perhaps for research as well.
My area of work is as a policy researcher at the King's Fund, so I write briefings on all aspects of policy that affect the NHS. There's been a huge amount of reform over the last 4 or 5 years. The aim of the reform, which is to create a patient-led NHS, has been the same, but what's changed is the way that we're going to get there. So we're using techniques which are much more akin to the market. So we're giving consumers, patients more choice. We're paying hospitals on the basis of what they do, which means they can compete for patients. And now we're extending this into the whole field of primary care.
I'm presenting on some of the political changes and some of the opportunities that are currently offering themselves to complementary practitioners. When you think that about 40% of all attendances at general practice are for minor ailments, most of which are self-limiting and could actually be dealt with by the individual by themselves, that's a huge, when you think that general practice covers about 250 million consultations a year, 40% becomes quite a significant element of that. We have a problem in this country. There's an infantilizing process that says when you're dealing with anything to do with health, somehow you have to go to a health professional to deal with it. Whereas in fact the vast majority of healthcare is actually delivered by individuals towards themselves and their family without involving anybody else. And complementary therapists have a huge role to play in actually encouraging that individual empowerment, which means that people don't even have to access the NHS services in the first place. And I think that is about individual empowerment.
We can do so much for chronic problems, which is totally missed within the NHS. So for us to be offering a service which is affordable and effective within the NHS is just, it's something that I really feel is very important.
If people are given elements of control and choice over what their treatment might be, we might be able to generate some more evidence about how effective it is and in what ways it's effective. So I think there's a lot of ground still to cover, but I think that the idea of putting patients at the centre and letting their choices really count for something is a venture worthwhile in itself.
It's going to be the case that people will incorporate complementary medicine into the NHS because it meets a need that isn't well met or cost effectively met by conventional care. Since no one can say this is how it's going to be, we've come together today to say, well, this is how we can imagine it might become. And what do we need to get from where we are now to where we envisage integrated healthcare being in a few years' time? I see it as the beginning of a network and a series of quite important initiatives in education, in networking and information, in, I think, a new sense of seriousness in the professional bodies about how they should be making inroads into the NHS. It's a real change point.